assessing for, whether physically, cognitively, or in any of these other dimensions, is not so much just how things are presently, but how they've changed since this bereavement occurred. I also want to know not only physical and cognitive or academic connections to grief, I also want to know something about behaviors. Again, if I'm speaking to the bereaved person, I want to know how they perceive things have changed. How are they behaving? It's probably where I'm going to try to learn something about alcohol or drug consumption that might have changed in this experience so that I can have an early warning, if you will, for there being dependency or increased dependency on those kinds of substances. It'll be a place where I'll ask a parent about how an individual child might be reacting to siblings or to friends. Is there more acting out? Are there more temper tantrums? Are there any problematic behaviors that the parent sees in a child or that an individual, for example, sees in him or herself? For that matter, it could be that it is some kind of a behavior that brought this individual to my office to start with. Someone in his circle of influence said, you need to get help because this is happening and it's happening more than it used to. And so knowing what those behaviors are and how the bereaved person perceives they've changed can be mightily important in supporting a bereaved individual. Obviously, I want to also know about their affective or emotional states. I want to ask at what points they feel particularly sad or lonely, angry, guilty, or fearful. Are there particular ways that they are experiencing those or other emotions as a part of grief? Now, I frankly don't start there with most clients. And one of the reasons for that is that I think we tend to run to affective or emotional issues way too quickly when we're supporting a bereaved person, especially for bereaved individuals who tend to be more instrumental, to use the term of Ken Doka and Terry Martin in their book Grieving Beyond Gender, more of a grieve by doing, grieve by thinking sort of person, as well as because many people are not particularly in touch with how things feel right now. I don't start with emotion usually unless, again, a bereaved person says, what I've come to see you about is that I'm just very angry, or what I've come to talk about today is that I just feel so guilty and I can't seem to get past this. Certainly in those cases, then my assessment is probably going to start more with an emotional piece because that's where the client started. But in other words, what I'm trying to do here is to determine as best I can a feel for how this bereaved person may apprise their emotional state. How do they assess it? What does he or she feel is going on for them emotionally, and how might I be able to help that? Now, I also want to know not only physical and cognitive, behavioral, and emotional pieces, I also want to know something about the bereaved person's spirituality. Now, that means a lot of different things to a lot of different people, and I find that many of my colleagues, especially practicing in secular counseling centers or in schools or in other places where there is a real reticence to talk about religious issues, often shy away from doing that or don't want to. My suggestion, however, is that we assess early on for relationship to a faith community, how the bereaved person's belief system has been impacted by this loss, how in what ways have beliefs perhaps been reaffirmed in this loss, what are some of the tenors of that, how does this person feel supported spiritually, how is that significant for him or her. All of those are very important. That's also, however, where I assess for hope, because I often operate out of very much a solution-focused counseling strategy. I want to know something about the hopefulness, the future expectation of this bereaved person. Does he or she, while feeling very sad now, have hope that one day things will be different, or is he or she rather hopeless? All of that really comes to the spiritual piece, as well as all of the various meaning-making, or what today we frequently call post-traumatic growth possibilities that a bereaved individual has. All of those are part of the spiritual equation, in addition to the more traditional understandings of religious connection, religious heritage, religious belief. As I begin to understand a little better where this particular client might be in their own spiritual quest or pilgrimage, I'm likely to ask something like, so where would you say God is for you now? Close at hand, far away, somewhere in between? How is that different for you than perhaps it was before this person died? All of those help us to understand the spiritual aspect of the assessment process. And then a final piece that I want to know in assessing a bereaved individual is something about his or her social support network. Now, one of the things we know about bereaved people is that it appears that people who perceive great social support are better off in the ways that they cope with the loss than folks who feel all alone and who perceive a lack of social support. It doesn't always appear to matter whether that support comes from a family member, from a very close and dear friend, from a bereavement support group, from a professional therapist or other caregiver. What seems to matter is that the bereaved person feels supported. One of the ways, though, that I like to inquire about that early in my interview with a bereaved person is to find out a little bit about what the people around them are telling them and how the people around them are acting toward them about this grief. In what ways do you feel supported, in other words, by your network? Who are the people who are in it? Who do you find are particularly supportive right now and that you're drawn to? Who are the people that you'd rather not be around right now because they are what I sometimes even half-jokingly refer to when I'm talking with a client as grief saboteurs? They're always working to sabotage your experience with this loss. They're always minimizing and telling you how you ought to be over it by now. And so one of the things that I like to do early in my work with a bereaved person is to hear just a little bit how he or she perceives they're being supported by their family members and friends, well-meaning or not. How are you supported, and how do you sense that? Now, all of this process can be accomplished fairly quickly as long as we don't play 64 questions with our client and try to ask every single question and try to get at every nuance of every part of this assessment in the first interview. Why, you could easily spend an afternoon with a client trying to fill in all the blanks, if you will, and that's part of the reason that I don't use a specific questionnaire formatted assessment. I've seen bereavement assessments that go on for 10 and 12 and 15 pages, and I suspect that becomes just a little bit irritating to the client, and it's certainly irritating for me as I try to build rapport and try to understand a little better where this client might be coming from. My point to all of this is really rather simple, though. Bereavement assessment is an ongoing process. I'm going to be trying to learn about these 6 dimensions not just today in my first interview with this client, but in an ongoing way. I want to be continually adding to my database of understanding about how this particular individual is facing and coping with this loss. And they are the teacher to me. I am not the expert, my bereaved client is. And understanding how they are apprising grief, how they are working through their loss, can be extraordinarily helpful as I come alongside them and try to support them in the bereavement process. Now, I alluded to this a few minutes, and I'll close simply with this idea. I believe that the place to begin with a bereaved client is where he or she is today. If they call our office and indicate an interest in talking because all of a sudden he or she has just failed to follow through on several commitments, and perhaps an employer has said, you need to go get counseling about this. Perhaps it is a student who is in our office now, having been referred by a school counselor or a principal because of behavioral issues going on at school. Perhaps it is an individual who says, I just can't seem to get past the fear that I have that this same thing is going to happen to other members of my family. Wherever the bereaved client is, I believe is the place to start in the assessment process. Start where they are. Let them tell us their story. And what we'll find is that as we hear the story, as we provide perhaps clarification, as we help them discover ways to walk through this grief, what I believe we'll discover is that we've become far more competent caregivers who use assessment in walking alongside the bereaved.